I am Phillip Wessinger with Steadman Hawkins Clinic of the Carolinas and Greenville Hospital System. I would like to talk to you today about the rehabilitation process after a total knee arthroplasty. How quickly someone moves through rehabilitation is very much dependent on the age of the patient, the condition of their other joints, and the overall condition of the patient. So outlining a timeline as to when you're expected to reach certain abilities to either get off a walker or onto a cane or to certain points in physical therapy can be variable from patient to patient. However, there are some things that are common to all people who are trying to recover from a total knee arthroplasty or even a partial knee arthroplasty. I think it's helpful to think about this as the sources of your pain. There are really two sources of pain in an arthritic knee. The first source of pain is the pain that comes from the fact that the cushion, the articular cartilage in the knee joint, has worn out. And there is now bone-on-bone contact, or very thin contact, that generates pain sensors and problems with being able to weight bear and do activities in a normal way. The process of wearing out a joint, though, generates a lot of inflammation within the joint. This inflammation in and of itself causes tissues to become swollen and inflamed, and over a long period of time can become shortened so that they no longer allow the joint to function like it should. In other words, they decrease your range of motion. The other is that when there is pain in the joint, people no longer walk or get up and down out of a chair or do functional activities in the way that they did previously. They start to limp, which means you're now using muscles in a way differently from the way they're designed to be used. This causes some muscles to become stronger than others, but it causes the majority of the muscles to become weaker. Particularly as activities become harder and harder to do, not using the joint allows the entire limb to become weak. The weakness and the loss of range of motion around the joint is a source of pain. When the surgical procedure of a total knee or a partial arthroplasty is performed, we do not replace the ligaments and the muscles around the knee joint. What is replaced is the surface where there is bone-on-bone contact. One source of your pain is eliminated by the surgery that's done. The second source then needs to be addressed by physical therapy. Therapy is a very, very important part of the success that you will have from your arthroplasty procedure. Working on range of motion, particularly range of motion in the early period of recovery, is extremely important. Getting the knee where it will come to full extension so that you can stand comfortably when you're standing in line or doing a task at home in the kitchen or at a workbench is one thing that needs to be focused on, and it frequently gets overlooked by the patient and needs to be encouraged by the therapist. The second is the ability to bend the knee or flex the knee so that stair climbing and getting in and out of a chair or getting down onto a lower chair or stool is something that becomes achievable. So working on range of motion while the wound from the surgery is healing, and also trying to stretch out those diseased ligaments and the muscles that are involved around the knee, is a very important part of your recovery. The second part of the soft tissue and the treatment of the soft tissue is to work on strength. This is emphasized from the beginning, but will receive more and more emphasis as you proceed in physical therapy, so that simple activities that you expect yourself to be able to do with your new knee now become easier to do and take some of the stress off of the joint itself. Paying attention to range of motion and strength during the postoperative period will give you the best opportunity to have a good result from your total knee. Thank you.